Hey, guys, and shine there, my friends and colleagues, and welcome to the I Give a Damn podcast, brought to you by Fluorescene Media, the same company behind ODs on Facebook. I'm your host, Dr. Joseph Allen, and today my special guest is Dr. Sweta. She is not only a clinician, she is an educator and a lifelong learner. And today we discuss not only her journey through eye care, but the power of self-education and how she inspires the next generation of optometrists to stay curious, adopt new technology, and lead a life with purpose. We covered several different topics in today's video, but I think Sweta has an amazing outlook and just perspective on eye care and motivation. And so I'm excited to share this episode with you guys. Without further ado, let's just dive right into it. Hit those like and subscribe buttons, and here we go with Dr. Sweta Das. Before we dive into the episode, I do want to give a big shout out to our sponsor, MacuHealth. If you've been following my content, then you know how deeply passionate I am about ocular health, as well as improving and protecting the eyesight of our patients in the clinic. MacuHealth is known for their triple carotenoid formula, lutein, zeaxanthin, and mesozeaxanthin. And whether you're concerned about age-related macular degeneration or just want to help your patients with the nutrients they need to stay sharp, MacuHealth has you covered. We'll talk about MacuHealth again a little bit later in the episode, but otherwise, let's get going.
So growing up, I was overall healthy-ish kid, but I couldn't see in class as a kid. So my teachers recognized that early on. And of course, I failed the vision screening test. And one of my eyes would turn in or out. I can't remember now, but there was that component as well. So the only place where I would often go to was my ophthalmologist, because back home for me, by the way, is India. So back in India, there was no concept of optometry at that time. So I would see my ophthalmologist often, and he recognized that I needed glasses to not only see well, but also keep my eyes straight. So he, of course, prescribed glasses, and I hated them. Like, it was one of the most hideous type of hair you could ever imagine. Probably there was no fashion sense at that time, or my parents didn't care as much, or I didn't care. I don't know. I can't remember. But
it was like the BCGs they call in the military, right?
Oh my God, like those like hideous, like really old grandma type, which I have nothing wrong against that. Like right now I am old grandma, but did not like them. My friends, like I would get teased a lot because, I would get called like four-eyed girl and, girl with like wonky eyes or something, things like of that nature. So all the time, I would conveniently lose them or misplace them or, just accident happened to my glasses. So he recognized my ophthalmologist. I still remember his name. His name was Dr. Rao. He recognized that I hated wearing glasses. And instead of asking me why do you not wear glasses, blah, blah, he just once got to me in the sense that he was like, hey, you know what? Glasses give you superpowers, and nobody else knows that except you and me. And he's like, this is our secret. You have special powers because of these glasses. And I bought it. I was like, yeah, I have special powers, of course. So that got me started to wear glasses more often. And I thought eye doctors were cool because he helped me. And I looked forward to seeing him because he was really awesome as a pediatrics ophthalmologist. Really awesome.
That's amazing.
Yeah.
And then, so correct me, you had some form of strabismus. Were you a hyperope, myope?
So right now I am a myope, but incredibly different prescription in both eyes. So I also have that aniso component. And right now I can be exo or ESO depending on,
how your accommodative posture and everything is.
It's wild. Like one of the professors, shout out to Dr. Jenna Lighthizer from NSU OCO. She was like, Sweta, she was fitting me with scleral lenses during my residency. And she's like, Sweta, you have a ESO. And then when they would measure it at distance, that would be EXO, at near ESO, and sometimes it would flip. So honestly, I am all over the place.
I do love hearing people's stories like that, because almost 90% of every eye doctor I talk to has some history where they were really motivated by just an amazing experience with another eye doctor who inspired them, or they themselves struggled with something visually. So I'm happy that you met an amazing doctor who had a great influence on your life.
For sure.
Now, you also have an interesting part of your educational history.
Yes.
That ties into eye care.
Yeah.
Can you share a little bit more about that?
Absolutely. So I graduated from this program called Ophthalmic Medical Technology Program. This is offered by University of Ottawa. Shout out to Canada. I'm Canadian. And this program is so awesome because I got to experience, so first off, people who don't know OMT, Ophthalmic Medical Technology Program, it is like 4 years program. 2 years you do just general biochemistry core science courses at University of Ottawa. And then the other 2 years, you spend your time at University of Ottawa Hospital, Eye Institute. And there I got to, and only 3 students are accepted, or at least at that time accepted every year to OMT program. And it was wild because you get to learn how to work up patients for different specialty in ophthalmology. So neuro-ophthalmology, uveitis, glaucoma, retina, what have you. But you also get to learn all the cool diagnostic testing that we do, like Goldman visual field, UBM, B-scan, ERG, fluorescene angiography. So all of that is done by OMTs. So I got to train and learn all that cool diagnostic testing. But what I found was the most coolest thing about the program was that there was no pressure. There was no burden of like doing what medical residents had to do, like ophthalmology residents, because I got to attend all the lectures that ophthalmology residents were attending, or most of it. So 5:30 in the morning, I would attend their rounds with them. So 6 ophthalmology resident, 3 OMT students. We would all be together learning from, let's say, retina surgeon or neuro-ophthalmology or uveitis. So I got to learn all that rich material without any pressure of, surviving the residency. And there were some surgeons or residents who were like, if I would ask many questions, they would be like, hey, you don't have to know that, you're an OMT student. But then there were others, like the neuro-ophthalmologist, Dr. Vivek Patel, shout out to Dr. Vivek Patel if he listens. He was incredible. Like, he would never say things like, oh, you don't need to know. He would understand that, hey, she's curious, and he would answer no matter what question I'm asking. So that helped me learn wildly without any burden of pressure of making it as residents, which I saw, like there was a lot of pressure on them. So that was really awesome, I thought.
I'm jealous of that opportunity. Yeah. That sounds cool. I think and something that you and I share, which we'll touch on, is really just that thirst for knowledge,
right.
That level of curiosity.
Exactly.
Of why is it this way? What happens if something else changes? And that having that level of genuine curiosity in a place where that is almost encouraging you
yes.
to thrive in that area. And of course, like you said, a little bit less stress than we typically experience, whether we're in school or residency.
Right.
That plays a factor.
Absolutely.
So on that same note, again, you and I share this thirst for knowledge, curiosity, and really comes down to the concept of being a lifelong learner. Mm-hmm. Can you tell us what that means to you?
Yes. I'm gonna be really honest. It has a little bit of spiritual component for me personally. Because every time I open a journal, which I come face to face with the fact that as soon as I read few paragraphs, I'm like, oh crap, I don't know this. So first thing that comes to my mind is, I don't know this. And then all the negative stuff, maybe I'm alone, but my mind has a negativity bias in that I feel like, am I competent? Like all these questions come to mind because I'm facing the fact that I don't know this, or I don't know this yet. So those are the moments that, to me, like I sometimes want to get up and do the dishes or do something else. Like I want to get away from it. That's my first reaction to being a lifelong learner. But I recognize this. And that's when like the work happens, as in sitting down and finishing that journal, sitting down and finishing that chapter that I'm reading, which I realize I don't know yet. But if I sit down and at least do a chunk of it, I will know more than I did before. And to me, that keeps me humble. And humility is something that I learn again and again and again. Every single person that I admire, for example, we were talking about Rich Roll just before the podcast began. Like every single person that I really admire are super humble. And for better or for worse, life has a way of humbling us all if we let it. But to me, lifelong learning keeps me humble, keeps me grounded, gives me routine, because if I have a routine for day-to-day life practice, I just feel more grounded. And in this uncertain world, it's that certainty, small little piece of certainty that I have by having a daily practice of learning something new.
I think you've touched on so many really good things there. First, I know myself, I have those thoughts. And I think most people probably in healthcare professions feel that to some degree, that if they are reading something that they realize they don't know, or they're not extremely proficient in, like you may have, we touched on this in school, but now I'm really studying it and realizing it's like I don't have a PhD in this area, but I'm trying my best as a clinician to fully understand where the current evidence is at, so that I can better my own skills, better take care of my patients. But there are those thoughts that perhaps, I don't know if it's ingrained in us because we were high academic performers growing up and in school, or if it's something that was ingrained in us in our optometry or in higher medical education, to feel guilty. Like we need to, like we're in a position where we're expected to know everything, right? It's impossible, looking back at it from a human standpoint, it's impossible. We can't know everything. So I feel where you're at.
And I want to add something. So you're absolutely right that we cannot know everything, but I also feel like it's like the situation of an asymptote where it never quite reaches infinity, but it keeps trying. And on a flip side, it may seem like, oh my God, like you just keep trying and never get there. If you see it through that perspective, it may seem kind of dark. But then if you see it from a different perspective, where there's something that you are reaching for, something that you're aiming for, and you keep going, even though you know, or at least I know, that I will never, like you said, know everything. But I'm never going to stop trying.
I want to take a quick break just to remind you about today's sponsor, MacuHealth. If you are listening to this, then you probably care about eye health just as much as I do. MacuHealth offers a line of incredible supplements that's formulated around published science. MacuHealth is known for featuring the 3 most important carotenoids for your macula: lutein, zeaxanthin, and mesozeaxanthin. Whether you're managing age-related macular degeneration or simply looking to offer your patients a high-quality supplement you can trust, MacuHealth has your back. Now, back to the episode. And I think that's kind of the, you also touched on the struggle.
Yes.
Like there is a struggle in pushing yourself
Right.
through that discomfort, right? You're in
Yes.
that uncomfort, that
Yes.
zone of discomfort.
Yeah.
You're trying to get through that discomfort zone.
Uh-huh.
And through that process, it's kind of like hitting the gym, right? It's like most of us, there's some days you just don't have the energy and you're like, I don't want to go to the gym, but I know it's good for me. I know I
Right.
really should.
Yes.
And if you struggle, push yourself through that, eventually you will feel good about it. You're happy you went, you got a little sweat on, something like that.
Yeah.
But I've been there. Even just yesterday, I'll tell you, I was reading articles and I felt a little bit bad that I didn't fully know that topic. But then I also felt this, like, I don't want to do this right now,
Right.
but I know I need to.
Right.
And or I felt like I need to understand this at a level that I feel comfortable teaching it to somebody else. And that you have to push yourself through that
Right.
discomfort zone of knowing you don't know something.
Yes.
And then sometimes rereading a section or reading
Right.
somebody else's publication
Right.
to better understand and digest what you are currently learning.
Yeah.
It's just, I feel exactly where you're at with that, and it resonates.
And then there are times where I feel like after reading something that I didn't know before, but now I know more, all those cases come to mind where I'm seeing these patients and I'm second guessing, was the first diagnosis okay, or is this, other differential diagnosis that I'm thinking now because of the knowledge that I have now? So I have to go back to all those patients and then bring them back, do another eval. But I have come to recognize that all of those things are good things, and my patients appreciate that. And I know everyone can probably agree on that patients absolutely appreciate if we are like open to them and saying, hey, I need to do some more additional tests. Please come back. And for the most part, it's good.
Now, I've had a very similar experience where I've admitted to patients that I don't know something.
Yeah.
Or I'm not fully on top of that because it's like, I studied this in school.
Right.
I remember this. I know enough that I don't need to send you to somebody.
Right.
But I need a couple of days to just really dig into something.
Yep.
So let me give you a call in 2 or 3 days and we can talk about the next best steps.
Exactly.
And did you ever especially early out of school, residency, did you have a moment where you felt pressure that you needed to know absolutely every answer?
Yeah, so the two examples that come to mind, scenarios, one was actually at NSU, well, I shouldn't say one, there were several experiences at NSU OCO, so Northeastern, basically Oklahoma College of Optometry. Mm-hmm. That's where I did my residency. And there, patients are wild because they have to drive really far to see ophthalmologists if we're referring them out. And some of them just outright deny. They say, hey, doc, you have to figure it out because I'm not going anywhere else. Figure it out, let me know, call me. And they're very open and honest about it. So definitely had that experience where I had to just dig in, figure it out. Of course, reach out to all the professors and resources that there are, and there are so many resources in that college. So shout out to all the professors there. But definitely had that experience. And one of the coolest experience that I got to see someone else be in that shoe was actually at University of Ottawa, their CHIO, Children's Hospital, that's called. And this is Dr. Mike O'Connor, if he's listening, shout out again. But I got to see, and he's one of the best pediatric ophthalmologists, and I was learning as OMT student there. Once I saw him on Google, just searching something, and I was just curious. I was like, what are you searching, Dr. O'Connor? And I guess he was a little frazzled. He's like, yes, Sweta, sometimes even we don't know all the answers. We also search things on Dr. Google. And in that moment, he confessed something. He was like, for OMT, optometry, there is someone else you can sometimes send patients to, refer them as needed. But when it comes to ophthalmologists who are at the tertiary level, they have nobody else to send to. So I realized in that moment there's so much pressure on every single profession, no matter what, especially tertiary care, because they really have no one else that they can send to. So I guess we're all in the same boat, some ways.
And it's good that you mentioned that, especially putting your mindset into that tertiary care where they may be that last step, or there may only be a few other people on the planet that are kind of even at their level, maybe in a different university somewhere.
Yeah.
And that does, I imagine, push them.
Right.
And that's why they probably are so good and they have the reputation. It's because they have that lifelong learning, because they have to. They have this external driving force. It's part of whether their career or patients, people are depending on them.
Yes, you're absolutely right.
As a deeper question for you, obviously you are pushing yourself to study. And you have some of that genuine curiosity, but you are pushing yourself, taking time out of your day, your week, to investigate and research and presenting and doing all these other things. I don't mean to turn this into a therapy session, but I'm curious, have you ever put thought into really your deeper motivations? Yeah,
absolutely. So I think very deeply about this sentence, know thyself. And I know it is a religious term, but on a deeper, and I shouldn't say but on a deeper, but what I really want to say, backtrack, that when I think about myself and that sentence, I reflect on this a lot, as in, who am I? What am I here for? What am I doing? Where am I going? All those questions, deep questions that I think all of us sometimes think about, or at times think about. I think the why for me trying to learn more comes from the drive of being committed to a practice where I'm devoting my time, I'm devoting my energy, commitment towards something, and something that feels more deeper, feels true. I'm also going to sidetrack here. There is a Franciscan monk, Father Richard Rohr. I'm not religious, I'm not Christian, I'm actually Hindu, but I love his books. And one thing that he always says is that all of this is going towards something good. Even if in this moment it doesn't feel like it, even if in the very present moment it may feel like, how is this going to turn into anything good? Everything is going towards something good. And that is a belief that I keep very close to me. And I think my drive to learn more comes from that it is all going towards something good, where I could help people who may be going from one specialist to another specialist to another specialist because nobody is able to figure out what is causing this issue that they're suffering from or experiencing. I feel like if I have a small part in that to play and figure things out, that would be my, service offering.
Now, I know that you have this drive. You feel this service, this drive, this motivation to study, improve yourself so you can help more people and play that integral role. And I imagine, as you have, and even our viewers and listeners, there are some doctors I've met, and there's no offense to them, they just really wanted a job.
Right.
And they're happy to be a business owner, to have a job. They maybe not be just super interested academically. And I don't think there's anything wrong with that. But I'm curious how we inspire doctors to have that same level of curiosity.
Ooh, that's a loaded question and really good question. So first, I'm going to backtrack and say, I was smiling when you said, you want to prove yourself. So in my moments of deep reflection, that is something that I constantly ask myself, like, am I doing this to prove my self-worth? Am I doing this to prove myself? And, of course, I have to self-check again and again and try to bring myself back to the fact that I'm enough, even if I don't do this, even if I don't read this, I'm enough. And hopefully, if I'm doing the work every single day, I'm not looking for self-worth in this. Because if I am, then I'm on a hamster wheel and it's never ending cycle, right? Like the hustle culture.
It's interesting that you do mention self-worth, because that's something that I've had to investigate in my own mental health and therapy.
Right.
I think a lot of, especially young docs, because I was, I've been there.
Right.
When you're questioning your worth as a young doctor,
right,
it's easy to fall into people pleaser mode.
Right.
Because you just want to get that approval. You want to be doing
reputation, accolades, prestige.
And even just that, just like you want the patient to like you.
Right.
And there's definitely this difference between being a patient's doctor. What that means, and I guess we could negotiate, or not negotiate, but discuss what that really means. Right. But there comes to a point where you have to be a doctor, not your patient's friend.
Right.
Yeah. Hopefully you can kind of be both, but like when push comes to shove, you have to be able to say the tough thing, even if the patient isn't going to like you for it.
Exactly. I completely agree with you. But to answer your question about our colleagues, I absolutely have no problem with that, because the way I see it is that we are all in a different place, in a different time. As in, some people, and I know they're some of my good friends, they're so busy with life, and they have a really tight schedule, kids, family, work. So to them, I want to say, what you're doing is great. Like, keep going. Nothing to add. Like, I'm not, like, you are enough. You're doing just fine. If there is any moment gap that, comes in their schedule where they can read, let's say, an abstract, something that still excites them, something that, they're curious about, great. If there is an opening, take it. But if the schedule is super packed and you're already having to juggle so many things, I have nothing to add. And the people also, there are some people, especially like I can think of, like even my own family members, who are really happy with job and then family. And that's a different personality, so nothing to add there too. So I feel like we're all so different, and our differences make us rich as culture, as society, as community members. Because when I go to their homes, their places, there's a different feel that you get. You get this sense of hominess, right? Like, it's a different feeling. So we're all on a different path, or at least our own paths, and whatever works, that's fine. But if there is like a moment of gap that any of our colleagues get, even with busy schedule, I would say take it and still see what you're curious about, what topics you love.
And I guess it kind of goes back to the kind of the original statements of, like, we can't know everything. We can't be a master at every little thing.
Right.
And so I always rely on going to CE a lot of the times. It's like, well, if I am going to get the most knowledge in the least amount of time possible, keep me up to date, I'm going to pick the CE. Of course, I'll pick which ones I really think interest me. But that's why I love coming to Academy. I like going to all the different events, because I do get to hear from people who are really at the top of what they're doing, and they're researching really deep into areas of at least in eye care that I sometimes haven't had the time or have missed
Right.
Like that always blows my mind how much I'll dig into like PubMed on a certain subject, and then I'll go to a lecture and I'm like, I haven't seen that publication. Where was that hiding?
Right.
So it's that's a whole other the skills of research and self-education is like a skill in itself.
Absolutely.
So with you in your position, you teach.
Yes.
Tell us a little bit about your kind of what you're teaching, your experience with that, with students.
Absolutely. So of course, my interest is ocular disease, ophthalmic diseases, systemic disease, any kind of disease per se. But I also love anatomy. I feel like anatomy gives us that foundation, whether it's general anatomy, ocular anatomy, neuroanatomy. It gives us the foundation to then build our knowledge base on. And I heard this really great line from a neuro-ophthalmologist, Dr. Vivek Patel. He always told his residents and OMT students, he was like, if you know the neuroanatomy really well, everything else is easy. Because, and he was talking about neuro-ophthalmic diseases, because then it just becomes putting the pieces of the puzzle together. And it is very simple. So it's not a very complicated field, as long as our neuroanatomy basis is, solid. So I teach in those aspects, and I teach in clinic as well. So I think it's a good gig.
Yeah. I personally have also loved anatomy. I think, for just like you said, that it is a foundation.
Yeah.
And you can't really understand physiology that well if you don't really understand the anatomy. And it's hard to really understand pharmacology if you don't understand the physiology and the anatomy.
Absolutely.
But if you start, just like the way our classes in schools are really built upon, hey, you have the foundation of anatomy, you have the ocular anatomy, you have the physiology, pathology.
Yes.
But then you're like, oh, I don't need to memorize every medication because I understand where the receptors are in the anatomy, and I know how that affects both the physiology, and so
it works.
Yeah, and you just have to know, oh, that class is a beta blocker. That's going to do this, this, this.
Right.
And you can start to kind of figure it out.
Yeah.
Of course, there's nuance, but
right.
I think there's beauty in it.
Absolutely. Agreed.
So with school, are you teaching ocular anatomy? Are you just helping students in clinic? What's your role?
That's a really good question. So recently I taught 3 lectures in ocular gross anatomy, and I also do integrative seminar, which is integrating all this knowledge that comes from different courses and applying it clinically. And I do that with Dr. Rob Chun, co-IOR, shout out. So
we're going to be tagging so many people in this episode.
Exactly.
It's great.
So it's a mixture of both lectures and clinical teaching.
What have you found most rewarding teaching and working in the clinic?
I love getting into the nitty-gritty details of what I'm teaching and shout out to my husband for that, Brian Wong. He's an engineer. He helps me with animations, which are super cool. So I get super nerdy about like really, really gritty details that may be slightly hairy to understand, but the hairier, the better, because I feel like I'm that much more interested in solving it as to how can we present this better and engage students better. And then my husband, who's an engineer, but also has really good animation skills, he helps me out. So I basically get super into details about like mechanism and all that stuff. And then I take his help and he helps me out with actually bringing that, vision into action.
That's awesome.
Yeah. Yeah.
I think there is certainly a lot to be said about the struggles of teaching.
Yeah.
I know myself, I'm very visual. I love animations. I love video. I kind of think in a video way.
Yeah.
But I know from talking with other teachers who've been teaching for 20, 30 years, they've felt like there's this generational shift over the last I'll say decade.
I've heard that.
Whether it be because of 2020, the COVID era, having to go more indoors, do more distance learning.
Right.
But they say that there just seems to be this a gap.
Right.
I don't know if you
say anything to that?
If you have any comments on that.
I think that's a really good point. I don't personally have much to add, because here's the thing. I feel like what we have now is what I'm experiencing, and I take it as a challenge. Like, I've heard some professors say, hey, now we have to kind of act and put in so much jazz to our lectures just to make it just to engage students, just to make them come to a class. And that back in the day used to be a given. Like, students would just come to class. That was just, taken for granted kind of thing. But now we have to do all this, put all this effort. So I completely hear that. I understand that. To me, I find it super exciting that it may be as my experienced professor might say, that it's a different shift, it's a challenge. I see it as an opportunity and a challenge, which I love. So I have nothing, negative to add there.
So what's your kind of thoughts and feelings around the phrase work-life balance?
Oof.
Or another colleague of mine, a previous guest, Dr. Corey Lappin, him and I were talking about the work-life juggle.
Oh.
It's sometimes not balancing, you're actually just trying to juggle, right? You throw one ball up and hope not to drop anything.
Yeah.
But what has it been like for you practicing, teaching, married life outside of work?
At this moment, I don't feel like that balance is a term that is real. If we're doing something, we're definitely missing out on something else. That's how this world works. That's the world we are incarnated into, for better or for worse. But it would be awesome if I found out the secret. I will share then. But right now, no secrets. I'm struggling like everybody else.
But you otherwise mentioned earlier, before we started recording, you mentioned you guys love to do outdoor stuff.
Yes.
You guys like to get outside, right?
Yes.
I think that definitely fits with most optometrists, because we work in a dark room all day.
Yes. Yeah.
So what's next for you? What do you every few years it's good for us all to kind of reflect, what do we want, where do we see our career going? What are kind of your dreams and hopes for eye care? And
I would love to teach more. I am doing CEs, and I would love to add more meaningful CEs, hopefully, and help out all those colleagues who are super busy and you don't have time. Just come to CE. I got it. So I want to contribute more. I want to do more in that respect. And then someday I want to get a PhD. I'm old, but I also want to get a PhD, and why stop? I just want to keep going.
What, being that you mentioned you maybe getting a PhD, what area really fascinates you? Something that you at this time could see yourself diving into?
Yes, eye movement disorders, neuroanatomy. I know I'm geeking out. I have so many areas that I want to really dive deep. So it would just be, what time presents as, but those would be the area that I would be super interested in.
Very cool.
Yeah.
Well, no matter what, I wish you the best in luck with all of those directions. So thank you so much for being on. Clearly you give a damn about your profession, about pushing yourself, all this lifelong learner attitude, which I think so many optometrists feel, right? It's a very, I think most of us went into this field because we know there's something amazing about eyes, amazing about vision, gifting, really re-gifting the good, excellent eyesight, saving, protecting eyesight. And so I love hearing more inspiration and what drives people, and I'm excited for you. wherever it goes. I'm going to have to catch one of your CEs.
Yes, absolutely. Sounds good.
Well, anything else that we didn't touch on here today that you would like to touch on?
I think we did really good. Maybe, we can do a second round someday.
Right.
Yes.
Yeah. Especially, maybe once you start your PhD, we'll have you on and we'll dig into that.
Yes.
But thank you so much, Sweta. Thank you so much. And we look forward to seeing you soon.
Awesome.
So that was our episode for today. Thank you so much for listening in. Please, if you found something with today's episode that really connected with you, that really just resonated with your mindset, about your thoughts about eye care and passions, I encourage you, how about sharing your thoughts about today's episode over on Odie's on Facebook? Certainly this is co-sponsored, produced through Odie's on Facebook, and it's great to always see people's comments and their stories being shared over there. I'd love to see your guys' feedback. I'll join you over there as well. Otherwise, keep an eye on it, and we will see you and hear from you in that next episode.